Hi everyone, I'm Shawin Vitsupakorn, and I'm a student at Duke studying biology and global health.
And my name's Katie Thomas. I'm a second year Master's of Science in Global Health student studying health policy. Today, we're going to explore our Vast Connections team, policy surveillance of financing for universal health coverage.
1 in 3. One in every 3 people around the globe does not have access to essential health services. These are the most basic of health services. For example, seeing your primary care physician or getting life-saving treatment. So what do we do to address this issue? 3 words: universal health coverage, or UHC. You may have heard of this term before, and the COVID-19 pandemic has definitely amplified conversations surrounding it. But what does UHC actually mean? UHC means that all people have access to quality healthcare, regardless of factors like how much money they make or where they live. This all sounds amazing, right? But how do we actually approach and achieve UHC? We can conceptualize UHC as a cube with 3 key dimensions. First, we have population coverage. Which groups of people should we prioritize? Next, we have service coverage. Which health services should be covered? Lastly, we have financial risk protection. Essentially, what this dimension looks at is how much of the health costs are covered and how much in turn we as individuals would have to pay out of pocket. So when it comes to UHC, this cube makes it look very straightforward, but there are a lot of trade-offs that we have to make. For example, given that all of the funding for health in every country is limited, should we give a basic health package to the entire population, or should we give a more comprehensive health package to more vulnerable groups? These are very difficult decisions for us to weigh, and there's no clear-cut right or wrong answer.
And so that's where our Vast Connections team comes in. We are working to track different countries in their decision making process and how they're weighing these difficult decisions. So we are filling the gap to pull together different policies on universal health financing for all of these various countries. The goal is to create a data set where we have almost every country in the world. Right now, we're working on, of course, a smaller subset. So, to make this even simpler, because health financing is difficult and transforming policy into action is also difficult, let's think of it as a house. So, not all houses are the same, but they have similar building blocks that make it a house. So, windows, door, a roof. We also have some building blocks for universal health coverage. So, when we're building our house or building our UHC cube, they won't all look the same, but they will have some similar essential building blocks. So we are using Monocle, which is a policy um, data system that was created by Temple University um, in order to compile our policy data set from all of these countries and track their progress on building the house. So we've compiled a set of questions that was designed in order to understand from start to finish, what are these different aspects? How is each country doing on their tracking and building their house? So the very first question in our data set is a simple one. And I have an example of it here. And this is what it looks like in Monocle. So the first question is there a national policy for financing universal coverage? So for every single country, we go in and we're able to highlight the selected portion of the policy. And so this allows us to have a data set for every single country and compare across them. So like I said, we eventually hope to be able to create a data visualization, which will allow us to compare across countries and serve as a resource for countries that are looking to find alternate routes to their health financing and make those decisions. So our world is extremely interconnected, and we're hoping to fill this gap to create this resource for different policymakers in countries all over the world and provide this crucial information to allow for sustainable and equitable health financing. So thank you so much, and thank you to our team.